The purpose of this next tutorial is to illustrate some of the specific techniques for moving the teeth around as the part of the setup. We had already separated the teeth, and the models that are in front of me on the screen are the models that show the teeth separated. I show you an occlusal view of the upper model. There were some specific reasons why we chose to define and select the teeth that we did. And just to repeat that briefly, it is my intent to reposition the four upper incisors. The the canines are sitting here strictly as a firewall to prevent any undesirable morphing of the rest of the anatomy that is shown here in brown. Um, and obviously, the first molar is here defined for the purpose of being able to put the ID numbers on the models that are potentially going to be printed. Uh, this is probably as good a time as any to show what I mean by using the canine as a firewall. Let me grab a hold of this lateral incisor, and I'm going to deliberately and aggressively move it. And you can see how the soft tissue morphs and conforms to the newly created position of that incisor. Now notice how none of that movement bleeds past the canine. Now on the other hand, if I chose to move, let me just undo all of those movements, clicking back. Now, if I chose to move the canine, which I'm deliberately choosing not to move as a part of my correction, this canine does not have the benefit of the firewall behind it. And as I move this canine, look what happens to the anatomy behind it. You see how the tooth, it almost looks like a melting chocolate, if you will. So I'm going to undo this. So the moving of the tooth immediately adjacent to a non-defined tooth causes this distortion and warping of the anatomy that is very relevant. I'm going to undo all of those changes. And once again, going to the teeth that are protected by an extra defined tooth as a firewall, those changes do not affect the bicuspid at all. So that's an important consideration. So here I'm going to throw the two models back on the screen, and I'm going to try to reposition the lateral incisor. Going to move it bodily, lingually just a little bit, and I'm going to rotate it. And the toggling is done between the shift and control button. Shift allows for a bodily movement of the tooth, and the control produces the rotation. So I'm going to do the same thing to the lateral incisor on the patient's left side. Now I'm depressing the shift button, and that will allow me to move the tooth palatally. And if I need to produce a small amount of rotation, I'm hitting the control button as well as the left mouse. And now there is my rotation. If I need to move the tooth, again, body-wise, intrusively, this is the shift button, and the left mouse key will allow me to do the intrusion, and the control button and the left mouse will allow me to do a little bit of rotation. So by manipulating those three buttons, the shift, control, and the left mouse button, I was able to reset the upper anterior teeth. Let's take a look at this, at how this reset. Let's say I may need to move this central and this central ever so slightly. And maybe I want to intrude this one a tiny amount. So altogether, there was a little bit of change introduced, and it's looking pretty good. I could take a look at the animation of what I had accomplished, and that animation, this button right here, can be slowed down, and it could be limited to just the teeth if I prefer. So we reset the operative. Let's take a look at the lower ones. So here's our lower model before it is being reset. Going to select. I must be still in a, yes, I was still in a movie mode. So now I can select the tooth, and it looks like this central incisor needs a little bit of rotating. So from this view, I can affect its rotation. This central incisor could use a little bit of intrusion, a tiny amount of intrusion here as well. Let's take a look at it from a different perspective, occlusal view. This could afford to move in a small amount. This could afford to rotate mesiolingually a tiny amount. So those are the changes that I probably want to make. Say maybe a small amount of rotation on the lateral incisor as well. So that looks pretty good from this perspective. Let's take a look at it from the back. You can take a look at it from the front. Everything is looking good. Now what I also like to do is kind of roll it out around this way. And as I'm looking at the lateral incisor, I think it could be lingually tipped ever so slightly, so I could do that. And then see how the next tooth emerges behind that. I can lingually tip that as well. So I like the way the teeth are emerging one after another, so that looks like a fairly decent setup to me. And I can play out the animation of the lower teeth being moved. Just look at the lower model by itself, and there is our animation. And it looks like everything is shaping up pretty good. And if I'm happy with the outcome of my reset on both the top and the bottom, I have to turn the animation off, and that affords me the opportunity to just accept that and save before I continue. And now we produced the setup. This is the original model, but the setup had in fact been done. And here we are now able to produce a sequence of models based on the setup that we produced. Here is the corrected setup. That's the upper. And it's ready to move. Well, we'll deal with the model manufacture in the next tutorial. Thank you for watching.